My name is Dr. Asif Khalid, and I'm the chief of the GI section at VA Pittsburgh Healthcare System and an associate professor at the University of Pittsburgh Medical Center. It is February 2021, 1 year into the SARS-CoV-2 pandemic, and our manuscript entitled Acute Physiological Effects of N95 Respirator Use on Gastroenterologists Performing Simulated Colonoscopy is being published in GIE. It is my pleasure to discuss our work with you in this GIE video series. I want to start by acknowledging the hard work of my co-authors and the support of the VA Pittsburgh Healthcare System, without which this project would not have been possible. As the SARS-CoV-2 pandemic took the world hostage last year, it became clear that many of the measures we were taking to limit the spread of the virus and keep healthcare workers safe are likely to stay in place for the foreseeable future. Among the many changes healthcare workers adopted, use of the N95 respirator has received a lot of attention, including TV coverage of healthcare workers with facial bruising resulting from prolonged use of the N95 respirator. As gastroenterologists, many of us have noted a number of symptoms while performing endoscopic procedures while using the N95 respirator, including headache and fatigue. Prior small studies in healthy volunteers have suggested a number of physical and psychological symptoms resulting from N95 use, likely due to increased inspiratory and expiratory pressure and carbon dioxide retention. We undertook this study to improve our understanding of the N95 related symptoms in gastroenterologists performing endoscopic procedures and the association of these symptoms with any change in our vitals and physiology. Our study involved obtaining vitals measurements, including heart rate, blood pressure, peripheral oxygen saturation levels, and end-tidal carbon dioxide levels in gastroenterologists as they performed endoscopic procedures with an N95 and compare them to a baseline. In addition, we obtained respiratory belt plethysmography measurements to assess changes in depth of breathing with and without an N95. We also collected continuous EKG heart rate variability measurements as a surrogate marker of intracardiac sympathetic and parasympathetic effects resulting from N95 use. Finally, we collected detailed survey data of a variety of physical and psychological symptoms from the participating gastroenterologists as they perform procedures with and without an N95 respirator. One of the hurdles we encountered in our study design was how to attach physiological monitoring equipment to gastroenterologists as they perform endoscopic procedures and obtain repeat readings. A second difficulty was establishing a control arm that would provide a baseline against which the N95 could be compared. We overcame these study design challenges by selecting our VA simulation lab as the study setting. The participating gastroenterologists performed multiple simulated colonoscopy sessions while wearing an N95 and then just a surgical mask arm serving as a negative control. While not discussed here, we also included an arm in our study with PAPR use. Of course, this study design required a significant time commitment from all the gastroenterologists as well as the study investigators, which we deeply appreciate. Our results show that over 80% of gastroenterologists reported symptoms with N95 use, most commonly breathing difficulty of varying degrees, frustration, fatigue, and headache. The most common physiological change exhibited by gastroenterologists with N95 use included a statistically significant heart rate elevation. Respiratory belt plethysmography data indicated a significant increase in the depth of breathing while gastroenterologists performed simulated colonoscopy with an N95 respirator. Heart rate variability data revealed consistent intracardiac sympathetic and parasympathetic changes with N95 use. However, these results did not reach statistical significance. Our data also showed that the change in vitals appear to be concentrated in gastroenterologists reporting most symptoms with N95 use. We believe our results represent an early but important step in understanding N95 related effects in healthcare workers. We recommend further studies to confirm and expand on our results, not just in gastroenterologists, but in healthcare workers in other specialties as well. Studies are also required to assess the long-term effects of N95 use on healthcare worker health, job satisfaction, burnout, and loss of productivity, including time off. We also believe it is important to study the effect of N95 use on the quality of care we provide our patients. Finally, innovation is required to mitigate the negative effects of personal protective equipment like the N95 while maintaining its protective properties. I want to thank the ASGE and the editors of GIE for publishing our study and bringing attention to this topic. Please stay safe as we get through these difficult times. Thank you for your attention.